Hi everyone. Today I'm going to be demonstrating sitz baths or soaks. So before we get started, you want to make sure that you have read your doctor's orders, reviewed your policy procedure manual, did good hand hygiene. When you enter the room, you're going to ID your client using two identifiers, so name and birth date. And then for this procedure, we're using medical aseptic technique. Because you may come in contact with blood or body fluids doing this type of procedure, you want to make sure that you have a pair of gloves. Sitz baths or soaks are used often for clients after any type of perianal type of surgeries, so hemorrhoidectomies, episiotomies after childbirth, or maybe for the treatment of perianal abscesses. Using warm water as a soak or a sitz can actually help to cleanse that area well, so get rid of some of the old blood and dead tissue, and provide comfort, so decrease pain. We also increase metabolism and circulation to that area to promote healing. You'd never want to use a sitz bath or soak if there's active bleeding. So if your client has just had surgery, you're probably going to have to wait until the following day. Some of the things that might contraindicate treatment would be a client with a cardiac disease. So the vasodilation that occurs with this type of treatment can cause dramatic changes in someone's blood pressure. So it can cause a drop in blood pressure and cause your client to faint. If you do choose to do the treatment, just make sure that you're nearby, that you are sitting with the patient, or if they want their privacy, that you're just outside the door where you can be of help for them if they aren't feeling very well. Before you get started, you're going to do an assessment of the area that you're treating. So in that perianal area, you just want to have a look at the skin. If there's sutures there, are they still intact? Have they come loose? Is there any active bleeding? Is there any signs or symptoms of infection? And you all want to make note of all of this because you're going to document it later in your interdisciplinary progress note. You're going to describe the treatment to your client so they know what to expect. You don't want any excess of pain in that area, and you definitely want comfort. So those are the things that your client should be expecting, is that they're going to get comfort and relief from this procedure. So I'm just going to move the camera so that you can see all of the equipment that I have available here. So here is my sitz bath basin. So in the basin, there's a front area, so this is going to go into the front of the toilet. I have lifted both the lid and the seat off the toilet, and I'm going to place the basin down below. If I want to use this as a soak, basically all I'm going to do is I'm going to take warm tap water and I'm going to fill up the basin and just let the patient just sit on there and soak the area. If I'm using it as a sitz, then I'm going to use this apparatus here. So basically what I have is a bag with a long tube attached. I don't know if you can see from the video, but there's actually a little hole in the top. You want that directed upwards towards the perineum. So this tube just feeds into the front and clips into the bottom of your sitz bath, like so. I'm now going to fill the bag with my warm solution. And you'll see on the bag, there's a clamp. I can hang my bag up on my IV pole, or I could choose to hang on to it. I'm going to open the clamp, the water's going to come through, and it's going to spray up through the top, which it's not doing all that great. But you get the general idea. There it goes. So you can see it going now. Your client is going to sit there for approximately 20 minutes. I can keep refilling the bag. And then once that 20 minutes is complete, we'll assist my client off the sitz bath. I'll get them to lay down on the bed, and then again I'm going to do an assessment of that area. So what I'm expecting to see is that some of the old debris and blood that was maybe in that area has been sloughed off. I'm going to dry it off really well. I'm going to inspect the sutures or the abscessed area. I'm going to make sure that there's no bleeding present and that the patient hasn't suffered any adverse effects. So we don't want any burning of the skin, more pain than before, and those types of things. Once I'm done the treatment, I'm going to go back to the client's record and I'm going to document.